all very welcome. Good afternoon. Congratulations on making it to Friday. I hope you all weren't up too late last night looking at the election results coming in. It's certainly a time of interesting change on the political front as well as on lots of other fronts. My name is Eddie Ritson. I head up the Digital Health and Care Northern Ireland team's work on digital transformation and innovation. And today, along with my colleague Linda McRandle, we are going to be talking about technology-enabled care services. So Linda is going to run through a slide deck, and I'm going to say a few words just at the beginning of this, and then I'll hand over to Jennifer. My anticipation is, or to beg your pardon, to Linda, my anticipation is that you will have some questions, and I would respectfully ask that you either put those in chat or hold them until the end of the presentation, and then we will address any questions which have come up during the course of the presentation. So if you just want to go on to the next slide, Linda, please, thank you. So technology-enabled care describes a broad range of interventions which, basically they seek to use various remote technologies to gather data which may support diagnosis, inform clinical and care decisions, and enable better self-management by patients and clients and assistance to carers. It falls very much into a broad vision of care, which I think would be summarized as being, self-care where appropriate and possible, at-home care where appropriate and possible, and digital where appropriate and possible, with recourse to clinic and hospital services as and when necessary. Technology-enabled care is a fairly broad description. It describes a range of potential tools and platforms, and there's many means by which technology-enabled care can be deployed and delivered. There is a belief that some people hold quite strongly that technology-enabled care potentially has a huge role to play in the delivery of modern health and care services, most likely within reimagined and redesigned care pathways, as opposed to being a digital bolt-on to existing services. So we know from previous experience and from talking to experts in the field that the design and implementation of technology-enabled care services is not straightforward. We have some personal and organisational experience of this previously. And with that experience in mind, Digital Health and Care Northern Ireland, led by myself and Linda and other colleagues, commissioned a design agency called Big Motive, which some of you may know. They're based here in Northern Ireland, to do a fairly deep dive discovery project to think about how we might go about leveraging the potential that I've just referred to for technology-enabled care in delivering improved health and care services across Northern Ireland. And just go on to the next slide, please, Linda. Thank you. So we know from previous experience that when we talk about technology-enabled care services, some of the challenges that arrive and come up are around, I'm sort of talking down the left-hand side of this graph here, that there always is not a common understanding about what services we're talking about. So we need to define that. We need to think about what resources and changes in redesigned and reimagined care pathways might be required. And then looking at the right-hand side of this graph, it's all very good gathering and collecting and presenting data, but there needs to be rigorous thought given to how is that data going to be reviewed, who's going to review it, within which governance structures, what decision-making roles and accountabilities would be provided to people who are charged with reviewing the data and making decisions upon that. And then we need to think about the human factors what incentives and challenges might there be in terms of implementing a new way of providing care within our health and care service. And then at the bottom on the right hand side, there's a bit of a question about, well, are these separate services, or are these services which are going to be delivered via the Encompass programme? And there's quite a bit in that which we also need to think through. Next slide, please, Linda. So in commissioning this work from... Go ahead, Linda, on to the next slide, please. Thank you.
It's just taking its time and moving.
Okay. In commissioning this work from Big Motive, which has happened over, I can't remember exactly how many months, I think possibly the last 3 to 4 months, the way we went about it was to organise what we called a number of sprints. So these were like short, sharp experimentations, if you want to call it that, although not on the ground experimentations, but a focus across a number of different care areas, which included for this exercise support to the care homes, hospital at home services, the management and detection of hypertension, the support of people with long-term conditions, and telecare services. And the process involved the things which are on this graph. So we spoke to people individually. There was a lot of desk-based research and looking at best practice in other places. We convened through Big Motive a number of focus group stakeholders, and we've done extensive work on refining the reports which are coming out of this exercise, which I believe are now available on the Digital Health and Care Northern Ireland website. We can provide you with the web link to that, along with this presentation after the event today. So I hope that sets up a little bit about what technology-enabled care is about. And now I'm going to hand over to my colleague Linda, who's going to take you through in a bit more detail what we've done and what we've learned and observed through the process. Thank you.
Thanks, Eddie. So Big Motive have spent a lot of time convening a number of engagement exercises, and as Eddie mentioned, the outcomes reports for each of these areas are available, and the link is on this, and you'll have this sent to you. This was very much our attempt at gauging the temperature across the service as to what changes would be needed, what the barriers are, and actually what is the appetite for making better use of tech-enabled care services. At the minute, we do have a couple of contracts in place, and typically in any given month we have about 2,500 people who are monitored daily. Some of you may be aware of our contract with Tunstall and Radius, where people have various alarms positioned around their houses, but they're very much a reactionary service. They don't really focus on predictive models and prevention. And we thought maybe now that this has been in place for quite some time and we're about to commission perhaps new services, different services, that we should really do a bit of discovery work. And we chose these 5 areas, not saying that they're any higher priority than any others, but they were things that have been coming up in the different scenarios and forums that we've been speaking to right across the service. And we thought we would focus on these as initial findings, just to see where that would take us. And as you can see, these are just some snapshots to show that we did have a cross-section of people that are involved in delivering and also using our services involved in some of these workshops and some of the desktop research. One of the things that we did find is people are a bit confused about exactly what technology-enabled care is, what technology-assisted care is, and there has been services like this around our systems in patches for quite a number of years. So it was a good opportunity just to have these things in our back pocket to initiate discussion and show what the art of the possible maybe could be for people who had lesser understanding than others in some of the workshops. So we had 7 insights and 5 recommendations in all, and the first insight that we got was that participants were really positive and enthusiastic about the potential impact of tech, and we were really glad to hear that, obviously, because Eddie and I are both great exponents of using tech. There was a feeling that there was an opportunity to maybe help address challenges such as the capacity issues and help complex patient pathways and support both patients and carers to help manage people, particularly those with long-term conditions. Not saying that it's going to be easy, but the fact that there is an enthusiasm there is something that we want to explore further. There's a couple of comments throughout this presentation, and one of them was from a care home manager, and their comment was that the biggest motivator is if tech improves the patient outcome and keeps them out of A&E, or we're still waiting in an ambulance. Like, there's hardly a week goes by when we don't have some negative press around access to our services. So anything that we can do to try and alleviate that pressure and make it a better positive outcome for not just the patients but those people that are actually delivering the service, then surely we should be exploring what options are available to us. So insight 2, despite the positivity around tech, recruitment was challenging, and when I say recruitment, that's not recruiting into the service teams. That was actually us having difficulty getting people out of the service areas to be involved in the conversations. It took a lot of time and effort, and we had a full appreciation that people are so busy actually trying to manage the services that they don't actually have time to take a breath, take a step back and reimagine how they might do things slightly differently. Insight 3 was that patients and carers expect tech in their health and their care journey. And many of our participants spoke about how when people could turn up into a care setting, they're wanting to share information either from personal devices that they own themselves, or rather than asking for leaflets, they're saying, oh, sure, send me a link to that, or send me a QR code, or how can I get my health data to you more regularly and securely, rather than having to come in and have a regular face-to-face appointment with members of the care team when really I don't feel I need that level of support. Insight 4, successful tech implementation will require change management and to enable a shift in culture. And again, that's reflected in the previous insight as well, whereby people really want to take a little bit more control, and up until now we've been very paternalistic in how we provide our services, and where people are willing and want to make more use of tech, we should really be exploring what opportunities there are out there. But we need to be looking at how we're making all our services as readily accessible and removing some of the current inequalities that there are across different regions. And again, a service user quote, "It's my dream to see tech used more in health and social care." You couldn't ask for better if you were trying to promote the use of tech, if that's coming from an actual service user. Insight 5, and just to point out, not all our insights are positive. This one is pointing out quite rightly that the current system just isn't ready for tech. The infrastructure, capacity amongst our staff, and the strategy all need to be addressed. And that came from a number of sources in a number of guises, and was not really a surprise to us, but it was useful to hear it being said from those who don't work within our team. In Site 6, there's a concern that tech will replace human interaction in health and care, leading to more significant health inequalities. And that's not an unreasonable comment. Tech has the opportunity to be a really powerful tool for good. In no way would we ever want it to actually replace the need for human interactions, and there's no way we could replace all domiciliary care visits, for example, with a tech solution. But there are more useful applications of tech than are currently being used widely across HSC. In Site 5, there are contrasting views on whether tech should be standardised and centralised or provide room for innovation and be decentralised. And again, we had pole positions in different settings. Some people really wanted to have a lot of guidance and everything to come through one centre, and others were, we want to do our own thing. We want to go and explore. We want to find new ways. We want to find new tech. We want to deploy it in our own way because our services are so unique. So that's going to be a challenging area to try and address as we move forward. And another insight or comment from one of our participants is that we need to promote a culture of change, self-management and education, and that's very much what PHA has always tried to do around putting out information around how to look after yourself and keep healthy so that you don't actually have to avail of our services. And when you do get a diagnosis, to give you as much information to help you safely manage your condition and know how to access services when you need them. So moving on to some of the recommendations, and this is a quite convoluted way of saying we know we need to have a tech policy, but it can't just come from the people that sit in the digital health and care team. This needs to be something that needs to be co-designed with people that use the service, people who deliver the service, people who commission the service. It's not something that can be done just from a digital slant, because there's no way that will work. This policy isn't about putting in a piece of technological equipment. It's about looking at the end-to-end service and how we can put digital elements into that to make it better. Recommendation 2 is the development of a tech implementation framework, and we've already started some work on this based on the findings to date. So people need to understand if they have an idea of what they want to do to implement a piece of tech in their service area, what exactly do they need to do? Who do they need to involve in it? How do they get funding for it? What are the implications around sharing data? Is there cyber issues? How do we procure it? So we're working on how we can give people almost a checklist so that they know exactly what they need to do to implement tech in their service area. This was a big area that came out from the very first meeting. We need to really raise awareness and education around what tech-enabled care is. There's a lot of ambiguity and misunderstanding about what it is and what it can and can't do. So we're at the moment trying to look at different opportunities to do a bit of education on what's available, and also then promote some case studies, etc., on our website to help people understand, because how do you know if something will work in your area if you don't even understand what it is and what the potential is? So that's going to be one of the starting points for us. And today's exercise is a case in point. And thorny issue. We need to understand the communication and funding models. We only have a very small budget at the minute, which is totally utilised to its max every year, and we need to look at perhaps different funding models for TEC implementation, and work with our commissioning leads to see how we perhaps have to change that going forward. We need to look at improved procurement methodology and increased involvement through the R&D teams, so maybe aligning more with the university to help provide alternative funding solutions, even if it is only for a trial, again to give us that evidence that people are looking for to show that TEC works and can be of benefit in their service area. And as ever, we need to create a TEC support and implementation team. We currently have a technology services manager in each of the trusts, but they're typically one person and they're trying to cover a lot of areas. So they're going to be tasked with being out and about, promoting opportunities and listening to teams to find out what problem areas are, to try and filter that back to see what we can do, harnessing the QI community as well, which is widespread across all of the trusts. And I know there's been a lot of time, money and effort invested in getting numerous people trained up in QI techniques, and surely we should be putting that into practice and trying to solve some of the daily problems that we have, and putting TEC in there, thinking digital solutions before we think of putting a human solution in every occurrence. So just lost my PowerPoint. Just to recap on some of the challenges, we've a lack of regional policies and procedures for implementing TEC, and trusts, because of how they're set up, have different processes, and we really need to think about how we can standardise the approach. The lack of funding, as with every service, is a problem at the minute, and a big gripe from a lot of our participants was there's too many pilots. We do things for a short period of time, the funding runs out and there's nowhere to go with it, and even whenever they've had really good results, that's it. It all ends, and that's very demoralising for everybody that's been involved in running the pilots. With a lot of complexity in some of the patient pathways, and I'm going to show you an example of one of those in a minute. So we need to look at how we can look at the pathways, try and see where we can put digital aspects into those, because that can actually have a big impact on capacity. The technology challenges, there's a lack of basic connectivity like Wi-Fi. You know, some of the care home managers that we spoke to were like, we don't have Wi-Fi in all our rooms, so we wouldn't be able to put that in. And not even in care home settings, even in some of our trusts, we have had queries and gripes about we have hotspots where we can't get access just because of the nature of the building or the location of the building. So we need to factor all that in when we're looking at what implementations that we're going to do. And there's a lack of connected health and care, so we're still working in silos. We've got primary, secondary and community, and trying to link those together is very, very difficult. Now, we do have Encompass in the foothills here, and we're hoping that that will address some of those issues, but it's not the only thing that's going to fix what needs to be fixed. So we need to look at other technologies as well. And there was also a concern about the accuracy and reliability of tech. So people want to know really good, robust case studies and local case studies. There is a bit of a, we don't believe it just because it worked in Scotland or Wales or in a county in England that it's going to naturally transfer to here. And that's absolutely right. We need to test these things robustly. And the people challenges, there's always the concern around consent, data capture, and how we're going to use and store the data. Who's going to see it? When are they going to see it? How's it going to be destroyed? How's it going to be shared? And that's where we will have to work, as always, very closely with our information governance teams to make sure that what we do keeps people's data appropriately stored. And the lack of tech awareness, including the definitions and the examples, and just team mindset. The first thing whenever you ask somebody to do something differently is, how much money are you going to give me? How many people are you going to give me to do that? And we would like to maybe change that mindset. And I'm not saying that it's going to be a magic wand, but we would like you to start thinking around what digital intervention might we be able to put in place that might help us, that might actually free up some staff time to do something different and maybe more patient focused rather than the routine things that maybe don't require an individual to be doing all the time. So this is a pathway that was mapped out in relation to care homes getting access to services if a patient went or a resident took on well of a weekend. So there's loads of touch points and what ifs, and depends on availability and depends on what trust. So you can see just how complex, and that's just one instance that we've taken the time to show you today. So wanting to look at the opportunities, because I am trying to be very positive about this. Using tech assessments to improve patient pathways and engagement with the appropriate healthcare provider. There's huge opportunities there. There's opportunities for capacity, resource management challenges through remote monitoring. You know, do we really need to be sending somebody into my home every day to check up on me if it's something that can be monitored digitally, and I'm willing to do that. Long-term conditions, like we already have great examples of how some of our COPD patients, our diabetes patients, self-monitor quite regularly and live quite independently without a lot of interventions from healthcare professionals. And hospital at home is being used more widely. And lots of people asking, could we maybe expand that service? But obviously there's a capacity issue there. And we want to improve the awareness and ownership of patients in their health and care. And we want to be more informed about patients' health through sharing the data, and obviously Encompass takes us part of the way on that journey. And then there's also the big one, the collection of population health data to identify trends and inform future services. At the minute, we're all very focused on dealing with the problems that are sitting at our front door now, and we should really be starting to look at how do we provide services in the next 5, 7, 10 years, and using tech will help us to do that. So you thought you were just here to listen to me today, but actually I have a few questions for you as well. So what barriers might we face, and how might we address them? And I'm asking this of you in your own areas. And have we missed anything? Because sometimes we're a wee bit too close to this, and maybe there's something else that we should be included in this work going forward. I should say that our team has committed to addressing those insights and the 5 recommendations, and we're actively working on doing something about that at the minute. So, for example, if we create a tech policy, how can we encourage you in the service to adopt that and make it work? And would you like to take part in the technology policy co-design work in the next couple of months? Because we would really like to have this work completed by the end of the year. So I'm going to stop just for now and take the chance to take some questions. I think I've seen a few hands going up.
Thanks, Linda. That was great. So yes, to people who have joined during the course of that, please do use chat to log questions, or if you prefer, put your hand up and we'll try and catch you. I think I did see somebody's hand go up during the course of your presentation, Linda, but I think it was taken down again, so it was perhaps an accidental hand.
Okay.
But I see that we do have one question in chat, which is from Penny Hobson, who has asked about regarding differences in care pathways. Once Encompass is fully rolled out, do you believe that the situation will improve? So I can give you a straight answer, or I can give you a flippant answer, Penny, but I'll probably give you a straight answer. Do you want to elaborate on your question?
No, well, it was not really. No, I thought it was probably. I hoped it was clear enough.
Yeah,
but,
it is.
You know, the issues that there have been about, you know, we're trying to work towards once for Northern Ireland, and it still seems very far away. But do you think, and is this something that we should maybe be cognizant of as we move forward, you know, designing the policy? That's some of those issues. The other one that occurred to me was the Wi-Fi infrastructure in the trusts, because there's a lot of infrastructure upgrade having to be done because Encompass is going in. And might we, hands up, anyone who doesn't know me, I'm actually part of DHCNI as well. Might we actually, or this, you know, technology enabled care actually benefit from that?
So let me start with the first part of the question, which is about the Encompass piece. And actually the graph that Linda showed with regards to the pathways for care home is a great example, and that was done in a number of different areas, and it's almost remarkable how complicated it is and how many variables are in play depending on all sorts of factors. So we don't have a clear measure or metric as to how much variation in care pathways there may be at the present time. So we're talking in very general terms. I would imagine that the implementation of EPIC through the Encompass programme will go some way to standardising some of those care pathways. But I think it would be a very heroic statement to suggest that, you know, all of a sudden it's, you know, we're going to have uniformity of care in ways that we haven't had before. And the kind of chart that Linda put up, I think, you know, there's, on that particular example, I don't believe the implementation of EPIC in of itself will have a massive, you know, consequence on the complexity of that particular set of possibilities for how people might move through the system. So, you know, it's a great step in the right direction, but it's not enough in of itself, and there's going to be an awful lot more work to do if we want to get to a more standardized care delivery system in the future. The infrastructure question, like what we're doing on infrastructure in the trust, like, and we're not in a bad place with regards to HSC infrastructure to start with. Obviously, when it comes to technology-enabled care, we are to a degree also talking about what infrastructure may exist in people's homes and what infrastructure may exist in the geography, in just across the country, so to speak. So that it's more than just what is there in HSC.
Yeah, I'm conscious that it would have, I was thinking about the trust infrastructure. Nothing we can do about care homes or people's own residences.
Well, I'm not sure there's nothing we could do about those things. I think that there may be things that we could do about those things, but we would need to think about them differently than we do at the present time. Like care homes is a great example here. There's potentially quite a lot of benefits that residents of care homes and staff who work in care homes may derive through the use of digital products and services, one of which could be technology-enabled care. And it would be a crying shame if they weren't able to benefit from those possibilities because we had not, as a system, worked out how best to support that sector with infrastructure. So I think there are questions to be asked which are like above the particular agenda around technology-enabled care, about how we go about commissioning services across a range of service providers.
Okay, thank you.
Have we provoked any more questions or thoughts or observations?
More importantly, have I any volunteers to help with the co-design? I might have to conscript some people.
Okay, guys, we're not getting the flurry of questions or hands up here. Okay. So if there's nothing further, then did you want to round off?
Okay.
And then we'll give people some time back in their day.
Well, indeed. So we really do want to look at some of these challenges. Obviously, the discovery exercise, people were very enthusiastic and very forthright with their views, and they don't want this to be something that is written up and sits on a shelf somewhere. So we will be following through on implementing those recommendations. And if you want to keep abreast of what's happening, you can follow the link on this slide that will be circulated. And if you want to chat to me about it or somebody else in the team, email addresses are on the final slide as well. And I really do hope that you have time to think about this. Sometimes whenever you're just listening to somebody talking about it, it's not to maybe an hour or two later you have an idea of, or maybe you just don't feel comfortable putting your hand up and asking a question. Please do reach out because we really need your input to make this work. And thank you for listening today.
Okay, thank you, Linda, and thank you everyone for attending. And enjoy the rest of the day and the weekend ahead. Thank you. Goodbye.
Thanks.
Thank you.